Hi everyone, my name is Candice Borg and I am the owner of Northcote Natural Therapies, and today I have the pleasure of interviewing Sarah. Hi Sarah.
Hi.
So Sarah is our biodynamic craniosacral therapist, which is a little bit of a mouthful. Sarah is a registered therapist who is passionate about helping people reach their full potential. She finds that this treatment works so well with people of all ages because it is incredibly gentle while also having the potential to totally change your life and has changed the lives of many. So welcome, Sarah, and thank you very much for being with me today and doing this interview.
Thank you. Yeah, it's a great opportunity, really.
Yeah, awesome. So I guess the first question is, what is biodynamic craniosacral therapy?
Yeah, it's a good place to start. So Biodynamic Crainosacral Therapy, which is a really big mouthful that we like to shorten down to BCST so that we can say it in a second or two, is it's a hands-on touch therapy that comes from its starting point from in a Western medical model of osteopathy. So the early the founders of craniosacral therapy as it is now were actually the early osteopaths right at the turn of the 1900s. And the therapy has morphed and changed over the last 150 years to be what it is now. It is a way of connecting with another person who's on the table that lets them feel heard and feel like their body is able to communicate back to the other person. So the practitioner has to be in a state of what we call balanced awareness. So we have to be really present with ourselves before we can even remotely start to work with another person. And the treatments look different almost every time, but the things that are the same are the person is lying on the table, fully clothed, blankets, nice and warm, and we come into contact. Usually I start at the feet and come into contact with the body, and we start to work together about what we notice. It comes from a background of like Western kind of anatomy and physiology. It plays a really big part in it. So we're looking at structures and we're looking at where there's blockages and things like that on a physical level. It also comes into energetic level of like where there's other kinds of blockages, which in craniosacral we refer to in different terms, but it's really the same thing as G or prana or energy that you might have heard of in any other kind of modality. And it also can come into a wider sort of sense, even outside of that energetic body, into a kind of wider place. I've gone around a few different things, but that's the beginning of what craniosacral therapy is.
Yeah, so I guess that uh, uh, after, I mean, I've had a treatment. Haven't had a treatment with you yet, which I'm so desperate for once this
You need
pandemic.
to book in.
I know. But I guess what I noticed is just the body being held and the practitioner being able to determine where there may be tension or imbalance and whether that's fluids moving through properly or so whether the person physically feels, I feel really tight here, or I have sluggish bowels, and that is actually because there's this bit that's a bit more taut and that bit that's a bit too lax, and so on and so forth. So your hands guide you as to where they need to go and what treatment needs to be done on that particular part.
Yeah, absolutely. And that's really common, actually. Quite often somebody comes in and they come in because they've got, say, for example, low back pain. And they've been dealing with this, maybe chronic, maybe acute low back pain that they really want to be sorted. And when I come into contact with the body, whether or not I come to the back, usually if someone's in pain, I don't go straight to that spot because that can be too much, and the nervous system kind of goes into a state of panic if there's a painful area. So usually we start somewhere away from the area of pain, and we the body needs to get to know me and trust me a little bit, and the person needs to feel completely safe first.
Mm-hmm.
And then, you know, they're there for a low back pain. We realize that, oh, there's this holding in the hips that, yep, we can work on that. Well, it's sort of like when I say work on, what I do is I go and I put my hands in the area and I listen.
Mm-hmm.
I listen with my hands, I listen with my awareness, and I notice what I notice.
Mm-hmm.
And then I might feel that there's a certain kind of pulling or a certain kind of tension, and I don't undo that thing. I just notice it and I just wait and see. And the school that I studied with was called Body Intelligence, and I now know, after studying it and becoming qualified, why they called it that, because it's shocking. Like, that's all I do. In some ways, all I do is I notice what I notice, and I go, oh yeah, so there's this pull, or there's this holding, or this block. Okay, what else is here? And then it moves and it shifts and things change. And the pace of it is completely dependent on the individual being treated.
Mm-hmm.
Some people will come in and there'll be lots of holds and things will move quite quickly because they're ready, you know, and it's just like, okay, I've come in, I'm here, and now we can move that and we can finish that one off.
Yeah.
And other people, I'll sit at the feet for half an hour, and it'll be really about coming into the awareness of the body, and the person will be really settling in and noticing their own body and their own awareness in a way that they don't habitually get to do.
Yeah,
it's always at the pace of the client. It's impossible to push it.
Yeah.
As soon as I said before about putting my hand on somewhere where there's pain, I've actually had clients who say, oh look, I don't care, I've had every kind of massage, every kind of thing, hurt me, I don't mind, just put your hand right there, and you know, that's where I want you to sort. And then I'll say, okay, I'll put my hand in that spot where it's sore, and then their breathing will just suddenly just go into pure panic, and I'll be like, your body is telling me I need to step back. And I'm not going to put you into a state of panic. That's the opposite of treatment.
Of healing, yeah. And I guess that also, you know, we have within our bodies, we store emotions and we store trauma, however that's defined by you. That I remember one of my clients once, I recommended that he go to do Bikram yoga, as it was, because I'm like, oh, I think it'd be really good for you, be good for your breathing and rah, rah. And he said, after he went, he said, I'm never going back. And I said, why? He said, because I cried. I went into one position and I just burst into tears and I'm so embarrassed. And I said, well, you're obviously storing some trauma in that spot. And maybe what he needed is actually to see you first, you know, and release that trauma so that he could then do the yoga without having that trigger effect. But I think that that's what's so powerful and important, that when we do experience different health conditions or not, you know, often a back pain isn't the back, it's or the knee or the hip or the or
trauma that happened when they were 3 and fell out of a tree or something, you know.
Or even a trauma of afraid to move forward, or there's some kind of block that's giving them this physical pain that's actually got nothing to do with the structure or the musculature in that area. So that's what I really love about this therapy, is that it's gentle and kind, and as you said, it goes to the pace of the person. So you can't push it any faster, you can't make it do anything that it doesn't want to do or isn't ready to express, but you can get through those layers of that onion of what holding that pain in that particular area.
And I'll be honest, I've had a lot of craniosacral therapy now myself as a client, and I don't think I've ever had 2 sessions the same. And really, I find that's a really important point about the person who had Bikram yoga. And like, I've been to different kinds of therapists in the past where it's almost like, yeah, look at this thing I found in your trauma history that I'm going to show you, and you can heal it, you know. And it's like, not ready, close down, see ya, never going back. And that's just counterproductive. I feel that the way I see my role in this is, I'm not there to heal you. I've got a really good phrase that somebody taught me was, I can no more heal your pain than I can digest your lunch.
Yeah, beautiful.
Like I'm there as a facilitator to help you to be able to find the places that you're ready to find at the pace that works for you. I've had some really amazing experiences on the table, and I've, you know, there's a way of doing it safely so that everybody feels that it's productive.
Yeah.
Yeah.
And not to fear it, I guess, either. If they know that they've had lots of trauma in their life and they're thinking, oh, I better not go see Sarah because it's going to all come up to the surface.
Yeah. I can almost guarantee that it won't all come up to the surface at once, especially if you've got a lot of trauma, because you've got your lifetime worth of ways of coping with it. And it's gentle, and it's very much at the pace of what you can deal with.
Yeah, beautiful. So what got you into this therapy?
It's really interesting. It was kind of like this little, you know, tap at the door for quite a few years before I actually took the plunge. I'd heard of it, probably the first time I heard of it was a dear friend of mine. I was in Bali, and she gave me a treatment of this thing that she did. And I had this really like amazing experience. And all she had done was sort of have her hands on the edges of my temples. And I'd gone off into like, I don't even know what happened. And I was like, what is this thing that you just did to me? And she said, oh, it's called craniosacral therapy. And I went, okay, I'll just put that in the filing system. Years later, a friend of mine told me it was quite good for her baby when her baby was having trouble with, I think, reflux and that sort of thing.
Mm-hmm.
And then I had a baby, and all was going quite well. And then when my baby was 13 months old, he suddenly got really sick really, really quickly and ended up in emergency at the Royal Children's, ended up having an intubation, ended up in ICU. And this all happened within like, it was like in a few hours from being a fine little kid to being in an ICU ward. So yeah, it was really intense, but the issue was fixable very, very quickly. It was an abscess on his tonsil. They drained it and it didn't grow back. And he got, you know, my little 1-year-old got pumped full of antibiotics and general anesthetic and morphine and all of, you know, he hadn't had a Panadol up until that point. But there were 2 issues after that. He healed, and then he just went back to being a normal baby.
Mm-hmm.
And then his father and I had to unpack our own trauma of having to go through that. That was one side of it. But the other was, you know, how can I was wondering how I could help this baby who can't talk to me and tell me about what he'd been through. You know, he'd had all these strangers in his face, and he'd had all these different drugs going through his system, and been in this really weird environment and been separated from his parents for a night and all that sort of stuff. How can I help him to process whatever there is there to process? And I remembered my friend telling me about craniosacral therapy, and I rang her up and said, oh, can you recommend this person who you saw? And she gave me the number, and I rang her up and went in for the appointment, and I'd given her the background and whatnot, and she basically just played with my little boy, and he had toys, and she played with him and put her hand every now and then on him when he let her. But the wonderful thing with babies is you can work without actually having your hand on them, because after newborn stage, they won't sit still. And it's beautiful because you don't have to make them. So it's great. And so by the end of the first session, I said, so tell me a bit more about this craniosacral therapy thing, because yeah, I'm in. And she happened to be able to tell me, actually, there's an information session of the next course in a couple of weeks. Here's the flyer, you know. And that, I haven't looked back. One session with my baby, and I've just been like, you know, okay.
Yeah.
And yeah, it's been quite a journey, because I signed up for a course that I had no idea how I was going to pay for. I had no idea how I was going to find the time to do it as a mother of a small child. I got pregnant with my second child while I was doing the course, and that pregnancy turned into quite a complicated pregnancy, and I ended up having to postpone my studies while I focused on the pregnancy and the birth of my second child. And yeah, somehow against all probability, I paid it off, I completed it, I still managed all of the other things that you have to do when you got tiny kids, and yeah, it's just a fit. It's just a yes.
Yeah, it sounds like the universe was giving you all these, everything lined up for you to make sure that you did it.
Pretty much, yeah.
Yeah, amazing. So we've spoken a little bit about a typical consultation, but go into a little bit more detail for us. So someone arrives and what happens?
So especially if it's a first consult, there's a bit of extra time set aside for taking a history and for really kind of talking about anything that they want to talk about. I find that's really useful, even if it's not really needing to be part of where I'm going to put my hands and things, but just to help people kind of, give me their story in as much detail as they want to. Then I tell them, ask them, I'll answer any questions they have about the actual therapy, and I'll explain what it is and what it isn't. I like to be sure people know that it's not a massage. I'm not going to be doing any manipulations or cracking in a outward sense. And then they'll get on the table. It's a massage table that's got blankets and pillows and things to make you nice and comfortable. And as I said before, I usually will start at the feet. So I have a way of checking in with myself and grounding, being present with my own system. And then only then will I put my hands on them. And always, if you're having a session, I let you know I'm about to put my hands on. Is that okay? And then when I feel like it's time to move, the way that comes is I'll be there and there's some conversation. I might ask you some questions. I might say, I'll help you to relax into the table and to feel your body and feel the, bit of a guided scan through your body to notice different things that are there. I invite you to tell me what you've noticed and anything in particular, if there's any pain or any discomfort or anything that feels really amazing. And especially in the initial sessions, I make it really clear that it's not about, it's not a massage where you expect it to hurt every now and then, or other kind of therapies where, a yoga class where you expect to kind of feel a bit out of sorts. So to be sure that people will let me know. And then let me know if anything doesn't feel good, and then I can change something. And then as we move through the session, I'll always say, okay, I'm going to move to this other part of your body, and then just check in every time, like, does this feel okay? Do you want me to move my hands at all? So that the person can feel as relaxed as possible. And all of that is about really letting the parasympathetic nervous system be online, to step away from the fight and flight and freeze response that we habitually spend most of our time in, and to let you know that you're in control of this situation and that you can lead it. There's no judgment. There's no it's supposed to look X, Y, or Z. If you want to move, if you want to, actually I need to sit up, whatever, you can change it. Perfect. Yeah, and that's sort of how it looks.
Yeah, and how long would that take?
So an initial session, I block out an hour and 15 minutes for that, and that probably is about 45 minutes on the table and leaving half an hour, which is really like before and after the session, having a bit of, so 15 minutes before, 15 minutes after, to have enough time to talk about anything that needs to be talked about. It might be a bit less. And then for a follow-up session, when we don't need to do quite as long as the history, we just need to catch up on what's happened since the last session. It's I block out an hour, and again it's about 40-45 minutes on the table, and then leaving a little bit of time either side for anything that needs to be discussed.
Yeah. So I'm sure that people are thinking this, but people can come in from work. They don't have to have a shower before they come in, or wear certain clothes or anything like that?
No. Sometimes, depending on what it is, I might ask you to remove jewellery or things like that. But otherwise, no, you don't have to be wearing anything in particular. You don't have to be... I've had often men who they wear belts on their trousers. Sometimes they have to remove them because like if I've put a hold at your lower back, or there's also a hold at your sacrum if that's comfortable. Sometimes that can be a bit difficult if you've got belts and things like that, but it's always within the realms of what you're comfortable with.
Sure. So,
and just on the topic of that, you definitely can come from activities, but it's useful if you've got a little bit of leeway after the session to not have to rush off to your next appointment or your next thing, just so you've got time to integrate what happened in the session.
Perfect. So as long as shoes can come off, belts can come off, and jewelry can come off if needed. But of course, if the person's uncomfortable, then that's okay.
Yeah, totally.
And you'll work around it.
Yeah.
Perfect. So what health conditions can your therapy help with?
Look, to be honest, I think the list is almost endless. I really think that this is the kind of therapy that can benefit almost anyone. I like to refer to it as a massage for your nervous system. Kind of just, it's, as I said about that, bringing down the stress response, really building the vagal tone, which is about the vagus nerve, which is the king of the nerves, the cranial nerves, and which is all about the parasympathetic nervous system, the rest and digest. Especially at the moment in this COVID-19 lockdown situation, there's so much fear, there's so much uncertainty. People have lost work, people have partners or households, income levels have completely changed. People are with their kids a lot more. There's so many things that are causing stress. So in general, any kind of stress, I would recommend craniosacral, specifically things like postnatal depression, which I'm actually, I suffered from for about a year after the birth of my second child. So I know it quite well. And I'm here to tell you that it doesn't last forever. And yeah, Cranio saved me during that time. So got a lot then. Things like more kind of chronic conditions like anxiety, depression, chronic fatigue, all those kind of, fibromyalgia, those kind of conditions. It's really wonderful for just to have somebody who isn't going to question you or show you a chart to tell you that you haven't got something that you're experiencing. Gut issues of any description. It's really wonderful for physical pain as well as emotional sort of conditions as well, psychological. Really excellent for newborn babies. It's beautiful working with a newborn baby because it's absolutely done with the parent as well, because if you're working with any child, you're working with the mother or the father, whoever's with you, they're connected. And the truth is, no matter how wonderful and textbook your birth is, it's still traumatic for the mother and the baby. There's a level of trauma there. And the baby can talk to me. It's like the most fabulous thing, actually. So newborn babies, older children that have got any kind of just difficulties often with sleep problems,
behavioural.
Behavioural things. It's had a lot of. I've got quite a lot of colleagues that have done a lot of work with people on the ASD kind of spectrum, and I've had some experience also working in that condition, and it's up and down. It always depends on the individual and what's going on. I always recommend if you people contact me to see their child who has Asperger's or autism, I say absolutely, yes, craniosacral can be really wonderful, but it's really important that the parents also get treatment and that they have support to be able to have that hour to have somebody else look after their child while they can come and get a treatment. Because anyone with a child with any kind of behavioural or any kind of neurological condition will attest they're the ones that are really stressed. And having an ability to take that, this is my time as well, can have a really amazing impact.
Absolutely. So what do you specialise in?
Well, if I was to say I specialise in anything, I would probably say working with pregnancy and newborns, and also working with people that are the people that I've seen the most at this stage would be people that have got chronic conditions that they're finding that other therapies or other modalities haven't been able to assist them or haven't done enough or something like that. And that's pretty broad, but yeah, I would say, like, you know, things like anxiety, depression, and chronic fatigue, chronic pain, those kind of fields. But yeah, having said that, like, that's an area of interest, but I wouldn't call it a specialization, because I would say, you know, because of the holistic nature of the session, like, see somebody who's pregnant to help them with their pregnancy, and it turns out, oh, they've got these jaw issues that they've been holding for their entire life, and, you know, so I work on their jaw, or, you know, it's because it's so holistic, it's really hard to say, oh yeah, this is the only thing, or this is the main thing. Yeah,
absolutely. And I think that you would be like me, that although these topics may be the ones that I see the most, or these health conditions may be the ones that I see the most, and I have a particular interest in personally or otherwise, but I love seeing everything because it even breaks up the day, you know, that it gives it makes work more interesting, because there's different things coming in, and you don't want to exclude anyone from
yeah, exactly.
Yeah. What has been your favourite moment while being a practitioner?
Oh, well, the first one that's come to mind is actually a moment when I was still a student, and I had just done my training in working with babies, and so I was finally allowed to put my hands on babies, which they'd leave until the end for good reason. And I had the opportunity to work with a friend's baby who was 4 weeks old, and it was possibly the most amazing thing that I'd ever experienced. We just did the session. I went to her house and I did the session where she was sitting up on her bed with the baby in her arms, and the baby was feeding for almost the entire session. And he communicated with me in such amazing ways. Like, I started off with just having my hands on the mum, on her back, and then moved my hand to the baby, and his little head sort of nuzzled into my hand, and then at some other point I put my hand on his back, and he kind of wiggled, sort of like went like this, and went, eh. I went, oh, okay, you don't want my hand on your back, okay. And then I put it back on his head again, and he went, oh. And it was just, and the mum was just so, like, this was her third child, so she was very aware of things, but at the same time, it was just such a beautiful thing to watch this little 4-week-old that normally we just think, oh, well, they start communicating when they're 2 or something, right? You know? Yeah. But yeah, right from the beginning, you can really tune into what they're actually trying to say. I walked out of there on such a glorious oxytocin high.
Wow, beautiful. That's amazing. And what's one fun fact about you?
A fun fact?
Yeah.
I guess I've always loved doing things with my hands. I'm a knitter as well. Oh, right. So I've always got a knitting project, and I am currently knitting a scarf from one of my kids. I just can't help myself. And so I've gotten from the point of, like, want to learn how to read patterns, and now I have to make it interesting. So I'd like try to make up my own designs and stuff like that, which is interesting. Wow. I have one thing that I knitted recently sitting here. I knit this last year. So this is a hat that I made for myself.
Oh, wow.
And I just had all these different colours of wool that I'd used to make a big scarf, and I just played around with it, and I was really happy with it. So yeah, my Instagram has got pictures of my knitting as well, because it's either a post about craniosacral or it's a knitting thing.
I love that. That's so amazing. I didn't know that about you.
Yeah, I just can't help it. Yeah, and I haven't been knitting through the summer, so I'm really not. Lockdown's been good for my kids in terms of knitting.
Yeah, absolutely. Lot of time at home to be able to do these other projects. So Sarah, is there anything else that I haven't asked you about that you want to cover in this interview?
There's one thing that I think that I forgot to say about craniosacral therapy and what it is about the way where it starts from. The focus of everything at the beginning of everything about craniosacral therapy is it's coming from a position of looking for the health in the system, and as opposed to looking for the ill health or the disease or anything like that. So it doesn't matter what conditions you've got, it doesn't matter where, how many different things are going on, there's still health present in every body, otherwise there's no life. And it can be a really beautiful experience to help people to find that within themselves, because many people that come for treatments have had years and years of lots of pain and discomfort, and lots of practitioners telling them all the things that they can fix and should do and this, and to let them find the lightness and the health within their system, which is also a present, is really great.
Amazing, totally amazing. So we are recording this during the COVID-19, during the pandemic, for anyone that's watching post COVID-19. What a world.
There will be a post.
Yeah, exactly. How fun is this world? So this is why we're doing it via Zoom. Sarah does have concession rates available for anyone who is struggling financially during COVID-19 or possibly beyond COVID-19. So please contact Sarah if you feel like you really would like to discuss more about this therapy and how it can help you, or you have some issues about payment, then don't be shy to ask, because if we don't ask, we don't receive. So there's always plans and ways around everything. And if you want to discuss more or book in a session, you can head to www.northerncraniosacral.com.au. On social media, it's the Northern Craniosacral is the whatever it's called.
The handle thingy.
That's it. I'm like, what's that thing called? You can tell I don't do my, the NNT social media. I have no idea what. Stick to what you're good at. That's what they say.
That's true.
So definitely please follow Sarah and find out more information about this amazing treatment and how it can help you, your children, your parents, everyone. Basically, there doesn't seem to be a condition that can't benefit from a few sessions. So be sure to contact Sarah and book in.
Thank you.
So thanks, Sarah, for your time today. It's been an absolute pleasure. I am so booking in. I am so booking in. We had a text message about, or a phone call about appointments earlier, and I need to do that. So thank you very much for your time. I appreciate it. And thank you everyone who has tuned in to listen to this interview.
Yeah, thank you very much.
Okay, see you later.
Bye.
Everyone.